I'm Mónika Hujter, and I work as a data scientist at High Labs. My journey to this career was not a typical one. I studied molecular bionics and infobionics engineering. This is where my passion for the connection between data and healthcare comes from. I believe that the impact we can achieve in this area has the potential to change lives for the better. This is very motivating, even though there are some challenges that are different from those of other regular data projects. The regulations are obviously very strict when it comes to new products, and for data management as well. The data we handle is very personal, therefore security is paramount. Trust is one of the most important factors when it comes to doctors. They have to consider complex aspects and information when making health-related decisions. The responsibility involved making is crucial to think together, share experiences, and understand the underlying professional and technological logic. I think a good way to build on this is to start working in a transparent, highly algorithmic, easily validated area, where at the same time AI can quickly save time by selecting, processing, and sorting medical data, images, and documents according to different criteria. Hungary has a fairly unique comprehensive system which manages all patient data from treatments to lab reports and prescriptions. From a data science perspective, this is an ideal starting point. However, data here is obviously very sensitive, limited in access and often unstructured, with a very diverse language makes the Hungarian and Latin words, unique abbreviations and special codes and so on. Fortunately, with the right data mining tools available today and the use of NLP and Gen AI models, all of this can be processed. Some data, such as lab reports, are originally produced in a classical tabular format. There are more complex things, such as radiological images or video recordings, that require image processing capabilities. And then there are the most complex free text documents, such as operative reports or discharge summaries. Experience has shown that often these documents contain 70 to 80% of the relevant information, but fortunately, they can now be analyzed directly if the models are trained properly. By recognizing correlations in the data that we have not been able to see before, it can make medical research faster. This in turn supports the development of better treatment and pharmaceuticals, as well as more informed preventive care. Early diagnosis and treatment, as well as more efficient patient care, is just the first step. With a comprehensive database approach, prevention can go even further in increasing our lifespan. By identifying early signs of illnesses, even from data from your smartwatch or analyzing medical histories and observing trends, we can make sure that more and more people get the treatment they need. All it takes is education, trust, and working with the opportunities run by emerging tech.